Thank you for having us here and open the space to talk about Cabo Delgado.
It's our pleasure. Let's then start by you, please, describing for us what the situation in Cabo Delgado looks like right now for the displaced families.
Yeah, what the teams on the ground, what they are seeing is that the situation is very volatile. And what happened was by the end of July, a series of attacks happened in the south of the province, close to the border with Nampula province, so really towards the south. And this series of attacks kind of triggered a massive displacement, a massive displacement. I think the official number says around 27,000, more than 27,000 people took refuge in Shiuri town. So what we saw was that those families they were allocated in the temporary resettlement camps, and these camps they were actually schools. It was like primary schools, so there was no condition for them to stay there. And that's when MSF started the emergency intervention, so we could really address the needs and try to prevent the spread of outbreaks, which was the main concerns of our teams. Now we start to see that many families started to go back to their homes, even though there's the fear of new conflicts, new attacks, and other families are then being moved to permanent resettlement camps in in the region as well.
All right, so there's been some little improvement, I guess. Then, and as MSF, you've launched your emergency response at the end of July. How have you seen that the services that you are providing in the temporary resettlement centers are improving the situation? Has there been, as you've been there since?
Yeah, we saw that many people could then have their checkups in our tents, in our medical tents. We understood that was the need was there even before the this new series of attacks happen. For instance, out of the antenatal care consultations that our teams provided, we saw like a high number of first checkups. So this kind of highlights that the people didn't have access to healthcare even before. So we could address all these needs there. And also, I think one of the first things that came together with primary healthcare was improvements in water and sanitation solutions. So very quickly, we were able to install some water points, as we call, to distribute clean water to the camps. And also, we did the installation of latrines that really create an environment that we can control waterborne disease, for instance, which are caused by not proper bathroom situation or dirty water, contaminated water.
International funding cuts have been reported. How does that affect your capacity to provide the life saving assistance that you are there to?
Yeah, Doctors Without Borders, MSF, as our French acronym, as we are known by our French acronym. We are a medical humanitarian organization independent, which means that, for instance, in 2024, 98% of our funds came from private donors. So we are not directly affected by the international funding cuts, but our part, like the other organizations, the other actors present in Cabo Delgado are. So what we are seeing is that the capacity of the other actors to react to this emergency is very limited, and this emergency it's really big. It's not something that one organization can handle by itself. So of course in our fundings we are not affected, but we are seeing that in the context that we work on, we are left really like without other actors to support the communities as well.
Are there particular groups, either children or pregnant women or the elderly, that are facing greater risks? And how, as MSF, are you able to meet or try and meet their needs?
Yeah, I think when we talk about these people, our biggest concern, MSF's biggest concern, is to really continue the care. The continuity of care, it's what is jeopardized when we have to halt our outreach activities or halt of our operations because of lack of security. So, for instance, one of the stories that the staff shared with me is this pregnant woman that had to she was very advanced in her pregnancy. She had to run away when the attacks happened. She stayed, I think, 3 days walking to find refuge, and by the time she found she was reallocated to this resettlement center, our teams were able to identify that she was at risk. She was at risk of having some complications in her delivery or even in the end of her pregnancy. So, together with the organizations who were present in registering the family, we were able to connect them, and then we were able to move this pregnant woman to what they call the mother's house, which is a house from the Ministry of Health that can welcome women that are at risk of having a risky delivery outside of the hospital. So I think these small actions is what we can do to really prevent that the worst happen, honestly.
Right. Marília, we'll leave it there for now. Thank you for giving us this update, and thanks for all the work you're doing as MSF there in Mozambique.
Thank you so much. I really appreciate having this space to talk about our operations here in Mozambique.
No pleasure. Marília Oliveira is a spokesperson for Doctors Without